And now, Warming Center Wednesdays with the Flathead Warming Center and KGEZ's John Hendricks, where we tackle hard conversations around the complex causes of homelessness and discuss how we as a community can collaborate to address them.
And joining me today, we have Kyle Waterman.
Hi, John.
Good to
Nice
have you
here
with us. I want to just give people a brief introduction of you. You're just kind of a man around all over the place. You were on the Kalispell City Council.
I was.
And so you've been around the community and working in a number of different projects. What are you doing right now?
John, I have been on City Council. I'm not in public service right now. I think there's actually a lot of things that we can do in other sectors, and I've always been in nonprofit tier, somebody who's worked as an executive director, and originally when I first came to the Flathead, worked with Intermountain Children's Services. Right now, I am serving as board chair for Western Montana Mental Health Center, which is an organization which is based in Missoula but provides us some pretty essential services for behavioral health. And interesting with that intersection where it comes with our conversations about homelessness.
Yes, let's see if we can kind of narrow that down a little bit. We keep hearing about, homeless people, how many there are. They come in from out of town because we've got all these great services for them, and yet we don't seem to be making any headway.
There's a lot of challenges, and you know that even when I served on City Council, homelessness was something we were first starting to talk about, and that was about 5-6 years ago. And that was with individuals sleeping in their cars. So this is a large problem. It is also an American problem. We're seeing this in other communities, in other cities. But I agree with you. I mean, I think that we have not seen a break in what we're seeing in the population. I think there's many factors. I have a wheel in front of me right now. I think that one thing, I just hate the word homelessness, because I think unfortunately we lump so many different problems together. And I do think that, that concern of people coming in and freeloading off of us, there's a population maybe there that's coming in and doing that. But what I see is that there's a lot of evidence that says it is locals, it is families who are in crisis, and I think behavioral health is one of those crises, addiction, but also just having a mental health issue. We also see a significant senior population, and we also see just different sort of local populations that we've had. Sometimes people are fleeing domestic violence, and that's why we have things like the Abbey Shelter.
We talk about behavioral health. I want to be sure everybody understands what that encompasses.
Thank you. So I think one thing that's really important is when I'm talking about behavioral health, I talk about serious mental health issues. Those are sometimes that's being bipolar or schizophrenic or having a post-traumatic stress disorder. But that also can be addiction. And so that's another, and sometimes what we see a lot of is co-occurring, where somebody actually has a mental health issue and might be self-medicating with drugs or alcohol.
Do we have the facilities here to help people who are having mental health issues?
We have facilities here. They are open, so Western Montana Mental Health Services, based in Missoula, but we do have a campus here. I think some individuals know that as Lamplighter. Other people know that as Glacier House, but the campus that Western has is just north of the hospital. And it is a 5-building campus. I wouldn't say that it is entirely open, but Lamplighter, which is our addiction treatment facility, is open. And we have counselors. So part of it is that we're meeting out with individuals, and we also do, and this is something that's been a good thing about the legislature, the last session, is we got some more funding back for caseworkers.
And that's something I want to spend a little time with here in a little bit, because I've been working with Representative Bob Keenan to try to get those funds distributed. So we'll talk about that here in a minute.
That is part of what I've been watching.
But what I'd like to try to continue to paint the situation and the scenery here for this. We see people walking up and down the streets talking to themselves. Now sometimes they've got earphones on and they're talking to somebody on their phones, but all too often, no, they're talking to themselves like they're talking to somebody else.
And there you're talking about sometimes that would be schizophrenia or bipolar, but I do, we caution us to note that a lot of people talk to themselves.
Yeah.
And we do have some individuals also, and I think that this is something that's really dear and near to my heart, is that we have individuals who might have moved to Montana 10 years ago and did not plan to have Alzheimer's. And seeing dementia and senior.
Oh, we're into Alzheimer's and dementia now.
I mean, they're just those are just. I mean, as we see those present, they present for different populations. Mm-hmm. So I do think that we should always be concerned about individuals, but not jumping into assumptions. And not everybody who's homeless has a serious mental health issue. Mm-hmm. But there is obviously an intersection there. And I do actually think that it's a very visible intersection, because sometimes when people are having a full-blown mental health crisis, that is actually where we see beyond just talking to yourself, where it is acting out, screaming at things, breaking things. Mm-hmm. And that's unfortunately some of the other foul acts that we've seen talked about at city council. That might happen in somebody's full-blown schizophrenic moment or having a breakdown. And I think it's really important to remember that the way to solve these issues is actually with people. An individual by themselves can't just always self-compensate and figure out how to manage these issues. It usually is a people-on-people. That's why we see therapists and counselors. That's why case management is really important, is because I do think we have to remember that it's going to take people, and how Western does it, and sort of the norm is that two people go out and meet with an individual who might be in crisis in the community. You have a social worker, somebody who's able to help connect that person to services, and then you have a registered nurse, somebody who might be able to give into prescription or get into the medical interventions.
So there are medical interventions available.
There are medical interventions available. I would like to say that there should be more. I think that that's actually what Representative Keenan is working on, and I do think that that is a larger challenge in Montana that systemically goes up to the state hospital. So in the last 4 or 5 years, we've had issues around our behavioral health system. It's been challenged, but I think that linchpin actually starts in the state hospital, which has not been able to, you can't really just have one hospital servicing all of the state of Montana. There's always been a philosophy that we should have more embedded community services. That has been a movement since the 70s. It was reinvested in the 90s. That's actually where our campus, Western's campus, comes. And today, actually, we use telemedicine. And we have different ways that we're doing, but there are different counselings and there are interventions. Then you have to remember that this is all voluntary. I'm talking about what people choose to do. Mm-hmm. So we're not forcing people into treatment and forcing things. That's because of civil liberties and freedoms that individuals have. But I do believe that there's ways to incentivize and also work with the judiciary to make sure that individuals who are in crisis and then involved in with law enforcement are seeking treatment.
Is it fair to say that some people who are in crisis with these mental health issues that you've described, not even aware of it?
I think they would be unaware of what their behaviors are. They may be having some visionary hallucinations that put them into a space, or an auditory hallucination where they are not necessarily of their full selves. And it depends. It shows up. I think that actually just the one being homeless and on the street is a really stressful event. And so somebody who has some traumas in individuals, they might not know necessarily how they're acting, but there are professionals who are able to go and do that work. And I do, again, it's a people-on-people sort of situation. Mm-hmm. And I think that that's sometimes what takes so long.
Mental health services, that's what we're talking about today, and probably discuss it in terms of the Warming Center and other places that are trying to do something to help people who are unhoused.
And I would point out that there's a very different systems. I mean, our behavioral health system and our housing systems in Montana and in America are very separate. And the Warming Center, the Samaritan House, are shelters. Mm-hmm. It is actually not they don't have the medical supervision to be able to provide clinical services. So detox and some of these they would need to work in partnership with an agency like Western to be able to refer individuals. And they might actually send somebody, and they do actually, Warming Center and Samaritan House, if somebody is needs Western's Montana mental health services or addiction services, they will send them, they will help connect that individual to the services so that that person can go to rehab, or that person can get counseling and get onto a treatment plan, which might actually involve medication.
How does all this get paid for?
John, I'm working with a majority below the poverty line individuals. So this is coming through the Medicaid and Medicare sort of systems. But we also in Montana, when it comes down to youth, there's specific designated funds. When it comes down to drugs and alcohol, that actually comes down, drugs and alcohol taxes do go into different local funding. Here locally, that goes to a different agency than Western, that's Oxytocin, which is providing rehab facilities.
So just because you're down and out and have no place to live doesn't mean that you can't get treatment.
That is true, and that is correct. And I do think that I think we sometimes have that debate of that social cost, but I think that is the right thing to do. I think it is right and fair for Montanans to be able to have local services. And I believe that there's actually a larger cost than just to an individual that we're helping Montanans work, because somebody's grandmother helps them out or somebody's parents help them out. And right now, I think it is exorbitantly expensive to send an individual private pay to like Utah or California. So I mean, those bills can be up to $70,000. We can do that at a better cost locally with more results.
The legislature last time around put some money back into the program once again and appointed Representative Bob Keenan to step up and help us understand how to best use those funds. Where do we stand with that program?
So you're referring to the Behavioral Health System for Future Generations Commission, which Representative Keenan is one of the chairs of. It has, so the legislature last year really set aside $300 million into this commission. Some of that is their ongoing operating costs, but then also that commission has been having hearings for the last year on the different sectors. It's hard to lump or to understand how many different behavioral health issues there are. Sometimes it comes down from addiction. Sometimes there's a youth perspective. Then there's also individuals who are born with a developmental delay. So there's different. So they've taken a year because it takes a long time, and government doesn't solve all of our problems. So you want to make sure you're doing all the right things, doing the research. So that's where that commission's done. That commission has also allocated money and started to put money down into the ground, which like an organization like Western can receive. So those have been some near-term initiatives where they've been putting down grants. The conversations that we've had over the last year around that commission have been that we don't need to build new facilities. We actually have facilities that might need to be updated, but they can be opened up. And then also that there's a pipeline issue, making sure that we have workforce that is going into, that is available and also able to get educated. And then looking at some future recommendations to the legislature, which will go to the session next year. So the commission is sort of basically spent down around 200 million of the 300 million that they have. So the next year, there's still 100 million that would still be going into the system, in addition to 22 recommendations that are going to the legislature. And they just had some joint hearings with the budget and with some of this, and this is where the state really should be taking the lead on this conversation, because it really is hard for municipalities or even the county to really take the lead on some of these behavioral health issues. They're really big ticket items. But so the committees yesterday were the judiciary and the budget and audit committees. And that was really important because that's the other spaces that we pay for these services.
Well, $300 million, that's a sizable amount of money.
It is a sizable amount of money. I think we will find that it spends fastly. And as I think everybody says, everybody shows up when there is some money, everybody shows up with ideas and not necessarily solutions. There are things moving forward with it. I think we're really fortunate actually to have the strong leadership of Representative Keenan and actually from the governor's office. And just sort of who the new department heads are. Like I say, the legislature made some choices last year that were, one, to fund this commission, two, to fund more case management. They also did some corrections around some things where individuals were being denied services, which I think is also right. So For example, individuals who are in the jail who are not able to receive services. Seems like if somebody's in a behavioral health or an addictions crisis in the jails, we should get to work with that. So there's some of those changes. And I anticipate the recommendations will go to the legislature, and not all of them will be funded. I think it'll be impossible to see the full 22 recommendations, but they are more guiding stars. So there will be some things that would be short-term initiatives and maybe things that would be implemented in long-term or 5 years from now. But the commission has been really taking a lot of time to listen. I also really appreciate how innovative they are. We need to be able to use technology to our advantage here in Montana. Like I say, this is a people-intensive services, and we live in Montana where predominantly, especially on the east side of Montana, it's hard to show up.
Yeah.
So we are going to need to be able to find how we do transportation, how we're creative with that, but also utilize telemedicine when and best we can.
You know, you bring up a lot of issues and a lot of questions. How many answers have we come up with so far?
So I think that we're starting to see those recommendations coming down. Like I said, the commission has come down to presenting a report. The report has 22 recommendations. And I think we're going to see what that looks like. I think we all need to take some time to listen. I think that part of it is making sure to listen to Representative Keenan, Representative Fern, and those commission members who are starting to present on that panels. But then also to look what that looks like in a community like ours. We historically have always been the smallest big town in Montana, which gives us a lot of advantages and a lot of grit. But it also, unfortunately, means that sometimes we don't have the services that we could have. And sometimes these new accesses, we're just going to be able to, it would be great to see them, I think, in the Flatheads so that we could self-resolve individuals who are in crisis. And this, to me, it's not actually just about Kalispell. It's about Libby and Thompson Falls. Because I believe that there are individuals who are doing just fine, living up in the Yak. But they end up with a crisis that came up, something they didn't plan. And that crisis snowballs into them losing their house, losing their car. And I do believe that those individuals end up in crisis here on the street in Kalispell. And it would be great to make sure that we're working with those more locally bound individuals in the communities that they believe that they can live and thrive in.
So what you're talking about here, Kyle, is you're talking about a solution out of all this thing instead of just trying to treat the symptoms.
I do believe that there is a solution. I don't believe that we're going to be able to solve everything. I think, but we have to do it in a Montana way, which is cost effective and with the means that we have. But if it is working with 10, 20, 30 individuals at a time, that's 10, 20, 30 individuals more than we're working with now. And I do believe we can see a long-term effect. I come from, I used to work with Intermountain, and there's stories of Brother Van who started Intermountain. Intermountain provides us therapeutic services for young children. But what Brother Van had seen when it was sort of back in the cowboy days and he was going around in Montana, he was riding his horse and he saw a lot of orphan children who were in the community, and he felt that we needed to do something about that. So he's organized and started the DEEC and started what is now Intermountain. I think that this is one of those times where Montana grit is really important, and we might not, we can solve some problems, but I think if we keep chipping away at it, we can make things better so that we don't see as many behavioral health crises happening out on our streets.
A place like the Warming Center, how essential is that into all that we're talking about?
The Warming Center to me has always been something that provides, makes sure that individuals don't die in the cold out on the street in the wintertime. When I was on city council, what I saw was, and I talked to the police chief, it was actually the police lobby that was where the last place of last resort was. That was not safe and not necessarily something that was working with law enforcement. So I think the Warming Center as an essential winter service, that is really important because winter is a health event in Montana. But I also, you can actually see numbers, and there's not enough data, and I'm a data person, about what's happening, but I can see numbers that actually say that we are making more connections because of the Warming Center. I also think we're making more connection because Western has caseworkers out there that are able to go to a place like the Warming Center, and that can be a place to meet up. And it is important to make sure that case management is always doing referrals, because somebody who might end up at the Warming Center might end up needing to go to treatment and then going to the Samaritan House and going through their program to get housing ready to actually get back into work and get into our community. I think it's a step-by-step process, and we actually sort of need the large network. And the Warming Center in that network is really important because it's shelter. But
yeah, you can't treat them if they're dead.
Right. That is unfortunately true. And I recognize the signs and the symptoms of some unchecked behavioral health crises that happen on the streets, and it breaks my heart. And I think that shows up in some other issues that, I've been on and talked about with like suicidality and some of those issues. I think we can do a better job about that. I hope that in all of our goals is for this sector to go out of business. I hope that we have a healthy, thriving community, that people are getting back to work and being able to pay for their housing and benefiting in that. That's not where we are today. But I think that can be an ideal of where we would like to be. And I would like us, I believe, to get to a space where Western Montana, which was providing services, has been providing services here in the Flathead for over 30 years off of our campus, about where we were 10, 15 years ago.
Yep. Kyle Waterman is always a very uplifting and an insightful conversation. Thanks so much.
Thank you, John.
Thank you for joining us for another Warming Center Wednesday. Did you miss it, or would you like to share it with friends? Find today's and past shows via flatheadwarmingcenter.org. It's Warming Center Wednesdays on KGEZ 96.5 FM and 600 AM.